It is a new day in Oklahoma and for the nation in our battle against addiction and the opioid epidemic. We have just this morning had the state of Oklahoma, had a settlement and a consent decree approved by the district judge down in Cleveland County with regard to our cause of action against one of the defendants in the opioid litigation, Purdue Pharma. Through this historic agreement, in which the state will enjoy a $270 million settlement, a nearly $200 million endowment for the OSU Center for Health Sciences Center for Wellness and Recovery will occur. This begins a new chapter for those struggling with addiction. I will outline the details of that settlement here in just a moment. First, President Hargis and Dr. Schramm, thank you all for both being here today and for your commitment to taking our fight to the next level. Utilizing the successful model that you have fostered here at the Center for Wellness and Recovery and expanding it through this endowment will truly create a national center for addiction treatment and research. It is going to save countless lives, and it's going to keep families together. And it's going to be the tip of the spear in terms of leading the nation out of the addiction epidemic that has claimed just this past year 70,000 lives. The fact remains, the addiction crisis facing our state and nation is a clear and present danger, but we are doing something about it today. Another data point, an average of 150 people in this country die every day from an opioid overdose. In 2018, life expectancy for Americans dropped again, in large part because of the continuing rising numbers of drug overdoses. According to the data from the Oklahoma Bureau of Narcotics and Dangerous Drugs, since 2004, more than 10,000 Oklahomans have died from an overdose. And in 2018, nearly 50% of all overdose deaths in the state were attributed to pharmaceutical drugs. Out of the more than 3,000 Oklahomans admitted to the hospital in our state for a non-fatal overdose this past year, 80% involved a prescription opioid. Quite simply, we are out of time with regard to the responsibility we have to deal with this crisis. But the money from this settlement will provide significant and substantial funding to the Center for Wellness and Recovery here, allowing us to focus our attention on what should be our highest priority, Americans struggling with addiction. I want to say that the OSU Center for Wellness and Recovery in these negotiations was selected because its footprint in this space is well established. It is the gold standard and is already a national leader in studying and treating addiction and finding innovative ways to cure it. And this money will allow the center to expand its mission to a national level to combat the crisis. And I know I speak for most everybody in this room in saying that I have full faith and confidence in Dr. Schramm and her talented team to lead this initiative. So I'll let Dr. Schramm talk more about the center in a little bit, but I want to say that the OSU Center for Wellness and Recovery is the nation's leading comprehensive treatment and research center for treating pain and addiction. It promotes collaborative and interdisciplinary approaches to the study of treatment and the public's understanding of pain, substance use, and abuse. Here at OSU, they treat addiction as a brain disease. When I was here for the launch of the Center for Wellness and Recovery back in 2017, something Dr. Schramm said has stuck with me ever since. It was her vision to start this program, and she started it with no new funds, with existing funds here at the OSU Center for Health Sciences, because she was dedicated to finding a better path forward for Oklahomans who are in need of addiction treatment. She did it because she knew it was important, it was essential to better understand addiction psychology, the role of the brain in perceiving and managing pain, and finding alternative modalities for treating those suffering with chronic pain. I continue to applaud you and the efforts of your team, Dr. Schrum. So the details of the settlement are as follows. The endowment will establish a foundation that will receive an initial $102.5 million that will go specifically to the OSU Center for Health Sciences Center for Wellness and Recovery. And beginning in January 1 of next year, the foundation will receive an annual $15 million payment over a 5-year period. And during that same 5-year time frame, it will receive ongoing contributions of addiction treatment medicine, both for rescue and recovery. And that has a market value of $20 million. So $4 million in rescue and treatment drugs over a 5-year period. Another $12.5 million from the settlement has been set aside to providing funds that will directly abate and address the opioid epidemic's effects in Oklahoma's towns, cities, and counties. Purdue will also make a $60 million payment to offset all of the state's litigation costs to this point.